lines start to develop with time, and there are minimal downtime in procedures that we can do to help patients get to feeling their best.
Yeah. Well, let's talk about those products a little bit. What would you typically use Botox for? Because that's the one you hear most.
Botox is something that we use to treat fine lines in the face. Those frown lines that people get in between their eyes, or those crow's feet that we get on the sides of our eyes, along with those horizontal forehead lines that we get. Botox is able to relax those muscles and allow the body to really create healing so that the skin lines aren't really noticed. And it's a wonderful, wonderful product that allows people to really get back to themselves pretty quickly.
How about the Juvederm and the Voluma? What are those? Tell me about them.
That is an excellent product that we use in order to fill in. They're called fillers.
Fillers.
And they use products that allow us to add volume to the skin underneath areas, whether we have small lines or depressions, to volumize our face and volumize areas that have created wrinkles over time, using a variety of areas, whether it be the folds of our nose, the nasolabial folds, even in periods of adding volume to our lips, which can also lose volume with time. And once again, it's an exciting thing when people can be able to get treated relatively quickly without a large operation, with all the downtime.
Well, what would one expect after having Botox or Juvederm? What might we expect to look like or to feel like?
One of the things that I like to tell everyone with Botox is that the effect can take sometimes one day to see the paralysis of the muscles. Sometimes it can take up to 2 to 3 weeks.
Really?
The one thing that people can feel are just differences in how their muscles feel minorly afterwards, because some of them get weakened to allow us to get that youthful nature again and not look so frowned with time. The same thing with the fillers. People will see a little bit of swelling in the areas that they have the injectable placed, and with time that volumizes, but all of that swelling and edema goes down. Generally, we have minimal bruising with these products and minimal downtime and not much discomfort afterwards.
So you can like go back to work like probably the next day or maybe even that day.
Sometimes people just come in for lunch and they get injected and that's it.
Yeah, I'll have Botox for lunch.
We'll sign you up.
Well, I know that we've got lots of viewers out there interested. And so how can we contact your office? What's the best way to get hold of you?
The best way to get a hold of us is to call us at the office at 754-8808 and arrange a consultation. There'll be a few questions that get asked, such as what medications you're on and what you're really looking for. And then we have you come in for a free consultation. We're allowed to have suggestions, and most often you're able to get injected that day.
Really?
Which is very, very exciting.
Yeah, and that's probably rare. Usually you have to have a consultation and then come back. Do we need a referral to see you, or is that self-referral?
That is a self-referral, and we're able to see you. We schedule you pretty quickly after that.
Good. Well, before we wrap up, is there anything else that you'd like to add?
Most definitely. 2 things really. The first is that we're excited to talk about our summer Botox and filler special in the months of June and July, where we're offering $50 off Botox as well as $50 off Juvederm and Voluma, and for the patients to call the office for details whenever they want that. It's really exciting to get people kind of coming into their summer form.
That's right. Well, we all want to look our best.
Most definitely.
And so we're happy that you're here to help us get there.
Yes.
And we appreciate you being on the show. We really look forward to coming back soon.
I look forward to seeing everyone.
All right. Thanks so much, Dr. Clark.
Thank you so much again.